Good afternoon, everyone, and welcome to Transit Talk, RVA Rapid Transit's regular webinar series. We're very thankful to have you here with us today. My name is Kendra Norrell, and I'm RVA Rapid Transit's board president. As many of you know, RVA Rapid Transit is a nonprofit dedicated to educating and advocating for frequent and far-reaching public transit in the Richmond region. I am also the community engagement coordinator for the City of Richmond's Office of Sustainability, and we're working on RVA Green 2050, the city's equity-centered climate action and resilience initiative, which connects directly to public transportation to help to equitably reduce greenhouse gas emissions. To begin, I just want to go over a few housekeeping details. We are recording the event today as usual, and we'll have it up shortly on our YouTube channel for folks who couldn't be here today, or yourself if you want to watch it again. To keep background noise down, please do keep yourself on mute during this event, but definitely add questions or comments in the chat section, and we'll have time for questions and answer based on those questions and comments. Our Transit Talk topic today is better bus stops. As everyone knows, amenities at bus stops like shelters and benches are a huge issue to make any transit system more accessible, equitable, and humane. Shelters protect folks from the sun as well as the rain, while benches provide a place to rest and wait safely for the bus. These kinds of amenities show care and respect for riders. As Stephen Higashida notes in his book, Better Buses, Better Cities, bus stops should be dignified places to wait. While people traveling in cars are shielded from the rain, snow, and hot sun, and most profoundly shielded from harm by seatbelts and airbags, it is a clear statement of disrespect that people waiting for buses so often must do so with neither shade nor shelter, without even a seat or a trash can, and often even without a safe way to walk to the stop. Also, Street Blog, Sorry It's Bus Stop shout out, the issue of limited bus stop amenities affects transit systems throughout our country. And in this front, Streets Blog USA even annually runs an America's Sorriest Bus Stop competition. You can see the wondrous 2017 winner from Seattle here on the screen now. Adam Lockett's Bus Stops Here project on a more local front, recent VCU grad Adam Lockett has created the beginnings of a local stop census for school project. He called it the Bus Stops Here. And in Adam's words, the Bus Stops Here archives deteriorating conditions, explores the social space of a bus stop, and dreams of a future people-powered census to gather information from all corners of the GRTC transit system. You can check it out at busstopshere.cargo.site. We are very grateful today to have two guests with us to help us learn more about bus stops locally and kinds of things we can do to help improve bus stops throughout our transit system. GRTC CEO Julie Timm and Bon Secours Director of Community Health, Sean O'Brien, will share in a panel discussion about the issue and recent partnership between Bon Secours and GRTC to get over a dozen new shelters installed in the East End. But before we dive into these discussions, we wanted to share a few State of Transit news updates, as well as some perspectives from RVA Rapid Transit Riders Voice program. The first update is on zero fare. There has been a lot of talk and support recently for GRTC to continue its zero fare policy as a way to keep providing financial relief for everyday bus riders. As many of you know, 54% of GRTC riders have household incomes under $25,000 and 79% have household incomes under $50,000. In very exciting news, just this past Tuesday, GRTC's board powerfully voted on an annual budget that extends zero fare for at least another year through June 30th, 2022. This is a big deal, and it is a testament to Julie's strong leadership in clearly laying out and explaining this issue for everyone. So thank you, Julie. It is key to note, though, that GRTC is currently using federal COVID relief funds to continue operating zero fare. So funding for zero fare past fiscal year 2022 will depend on state and local support. Stay tuned for more updates on that front. Next, GRTC has nearly completed its regional public transportation plan for this year. As you'll recall, this is the plan that GRTC annually submits to the CVTA for the CVTA to review and ultimately vote on regarding how the 15% of CVTA funding allocated to GRTC is spent. You can see here a list of some of the possible expansions. It is important to highlight, though, that the earliest any of these might begin is not till fiscal year 2023, or rather July 1st, 2022 at the earliest. The major issue pushing back these expansions is the need to fully recover from this pandemic time to regular operations, combined with a need to recruit and train more bus operators to implement any service expansions, there has been a challenging bus operator shortage for transit systems across the country. You can see GRTC's full draft regional public transportation plan at planrva.org/transportation/CVTA. This plan should be up for CVTA approval at its next meeting on June 25th. As many of you know, especially if you were able to join our last transit talk on transit governance, the CVTA has been working on a transit governance study, which is nearly complete as well. You can see a draft copy of the report at planrva.org. And all of these links are going to be in the chat box here on the Zoom. The study will be delivered to the CVTA and to the governor's office at the end of June. And we will see how the conversation unfolds from there. Certainly stay tuned for that one as well. Finally, just a reminder that GRTC is still running for essential trips only, and masks will be required through at least September 13th. Now I want to turn things over to Faith, who has a rider perspective to share through our Rider's Voice program.
Thank you, Kendra, and welcome back, everybody. So my name is Faith Walker. I am RVA Rapid Transit's Director of Community Engagement, and my work has been focusing on amplifying and supporting the stories and concerns and interests of everyday bus riders in decision-making about public transportation throughout our region. Now, I would like to give a big thanks and shout out to Elle from the Chesapeake Climate Action Network. She's been a major help and support while collecting these stories and feedback. So what I wanted to do today is just share a clip with you from a young lady by the name of Angie. I believe she was coming home from work. We met in front of White Oak Village. And so we'll play that right now. And this is gearing up to the conversation that we're having today.
My name is Angie. I take the 7B and the 7A. And there's a lot of stops around where I go that don't have benches, that should have benches because of not only elderly people, but pregnant women. When I was pregnant and having to take the bus and didn't have anywhere to sit, it was hard for me to sit on the ground and get back up to be able to get up for the bus in time. There was actually a time where a driver left me because I was sitting on the ground and I ended up having to walk home just because I couldn't get off the ground. They were impatient and didn't want to wait.
So Angie, thank you so much for sharing that story. And I would encourage anyone to share with me or share this opportunity for people to give feedback. People can reach out to me directly. My email address is faith@rvarapidtransit.org, or they can call 804-286-0007. Or you can see myself or Elle out at different bus stops gathering feedback throughout the week. And then also what we'll do is we also have a way where people can give that feedback by rider survey on our website, and we'll add the link there. So what I'll do is I'll turn it back over to Kendra.
Wait, okay. I am now unmuted. Sorry about that. Thank you so much, Faith, and thank you to Angie for that powerful testimony. We're going to turn now to our panel discussion with GRTC CEO Julie Timm and Bon Secours Director of Community Health Sean O'Brien about the issue of enhancing our bus stops. They'll be sharing in particular about the recent partnership between Bon Secours and the GRTC to get over a dozen new shelters installed in the East End. Welcome, Julie and Sean.
Hello.
Thank you. Hello.
So, Julie, we're going to start with a question for you, but Sean, please feel free to add in. This is intended to be a pretty informal and flowing conversation. So, Julie, could you share about why you think bus stop amenities like shelters and benches are so important and critical to improve and increase for our system?
We only have about 5% of our bus stops that have shelters. That we have about 1,650 bus stops across our entire system, and 5% of them have a shelter. About 20% have a bench. I think that probably the majority of the people on this call, I believe I'm probably preaching to the choir here, have some experience standing at a bus stop. When you're standing there, and I've done this, and I've talked about this before, at a bus stop, and you're waiting for a bus, and it's raining, you get soaked. If it's hot, you get soaked. Your clothes are wet, whether it's from the rain or it's from the sweat or it's from the snow. It just makes for an environment where you have to get from where you need to be to where you need to go miserable. And since the majority of the people that ride the bus are using it predominantly to get to work, that means that when you're standing there on the side of the road in the elements to get to work, without any shelter from the elements, you arrive at work in just in a unkempt situation, and you get that feedback from your boss about how you don't look like you should be here. You need to go home. You need to change. We don't want you here. You can get fired from your job for having an appearance that's unreasonable. And those are just like the top level things. I think that Sean will probably talk about more from what his studies had about the community and the psychological impacts of forcing someone to stand at a bus stop in the elements to wait for the bus, and what that does to a person's physical and mental and emotional health, and how that also expands to the health of the entire community. There's some very intangible elements to what impacts lack of amenities has on the riders. I'm not sure I exactly answered it, but I think that as we unroll this conversation, we'll get into the details and the meat of all those comments I just put out there as fact.
One thing I just want to add is that, studies show that already for riders for a bus or transit system, that their perception of how long they've been waiting is greater than the actual amount of time that they actually are waiting at that stop. But what having a shelter over your head, having a comfortable place to sit, having an ability to get there, to walk to that stop without a lot of obstacles, for it to be a very direct route, all those things can decrease that perception for those riders. And ultimately it's about providing a comfortable experience and, a respectful experience for our riders, and they deserve the best.
So, and I think that there's a comment in the chat box. I hope I'm probably Faith. I'm sorry, jumping ahead to that comment there about the real-time arrival, but it speaks to what just Sean was talking about. If you've ever had to stay online on the phone with, and you're in the queue to get answered, and you get that whole, they'll answer when you're next. They'll answer when you're next. You're like, eventually, and you're there for 2 hours. And I think probably most people have experienced that 2-hour wait if you have the time to do it. It's miserable. But when you get on the call or you get on a bus stop and it says that bus is going to be here, or that person's going to answer the call in 10 minutes, like, okay, and then 5 minutes, oh, okay, and then 3 minutes, you're like, okay, and then the bus is 1 minute away. Suddenly you feel like you have a little bit more control of your time and your destiny. And if 10 minutes is too long, you can do something else. It's a matter of how we psychologically interact with our wait time, and having to sit there and having that unknown and be that lack of control around how you access your own mobility and access your ability to get to jobs or education or healthcare or groceries. It causes a lot of tension and stress, physical and psychological.
Yeah, I have definitely had this consideration every time I get on the bus to go to work. So thank you. Sean, how did Bon Secours become interested in the project of helping get more shelters in the East End?
Well, there are a couple different factors involved. The first one was just, I guess, goes to the question of why would a healthcare system even be part of this work or see its importance. And over the past 20 years or so, healthcare has really evolved in their understanding of just how important it is, these things that impact everyday life for people, but what a major factor those factors are in somebody's health. Your access to a doctor or to a hospital is relatively small compared to the impact of it, compared to the impact of where you live, where you work. Do you have readily available transportation? education opportunities, work opportunities, where your kids go to school. So all of these social determinants of health, which is the fancy terms that they use to refer to the conditions in which we live our everyday lives. So as a health system, we every 3 years, often what we do is we do an assessment of the health needs of the community. And these health needs aren't limited to just what people would think were acute diseases. So especially for most of our hospitals in Richmond, the primary healthcare needs were things like access to transportation, access to behavioral health care, jobs. And so as a healthcare system, we're not qualified and don't have the expertise to actually do any of this. We don't operate a bus system or anything like that. But what we do is look for opportunities to invest with organizations that are working in these different areas like transportation to improve the conditions for the communities that we serve. So about 5 or 6 years ago, and this was through, we had been a strong relationship with RVA Rapid Transit with much of their advocacy work. And that also helped us develop a very close relationship with GRTC. And we were presented with a funding opportunity that would be matched by, and Julie, you might know better, by, I'm assuming, the U.S. Department of Transportation grant program for these bus shelter improvements. So as a health system, we made a decision that this is something that we would like to invest in, especially because we viewed this project as a catalyst for increased investment, not only by GRTC or by the state or federal government, but also by other local business partners who see the value in enhancing our transportation system this way. So long story short, Bon Secours has a foundation, and we sought some private investments in our foundation that we were able to bring to bear and match GRTC's investment for these bus shelters.
You kind of touched on this in your last answer, but can you go more into detail about how the partnership between Bon Secours and GRTC unfolded? Either one of you?
Sure. I'll start off, Julie, just because I want to add on one other point. There was a little bit of self-interest in this project as well, because Bon Secours has a hospital in Richmond's East End, Richmond Community Hospital. And we've really been focused on Richmond's East End for at least the past 15 years, especially in looking at ways outside of our hospital walls that we could improve the health of the community. But one thing that was, the hospital itself, our employees, our patients depend on GRTC in order to get to see their physicians, their caregivers, and get to work. And so one of the bus shelters as part of this project was the bus shelter in front of Richmond Community Hospital. So Julie, I'll let you start off with the conversation about how the partnership kind of worked out, or I'll add color as you go along.
Well, a lot of this happened before my time. It's one of the great things about being a new CEO. All these great things happened before I got here, and I get to take great credit for it. Yay. The truth is that having a health impact assessment or a community impact assessment to start with outside led to the foundation of understanding that there is a health connection, a physical health connection between transportation or lack of transportation and individual and community health and welfare. Having that leadership role, I think, was critical to the next step of what I understand was Bon Secours reaching out to RVA Rapid Transit and your leadership, and identifying that one of the key issues or barriers to good transportation was having access to shelters and benches and at those bus stops. That if you had to stand in a ditch, you might be less likely to get on a bus. If you're less likely to get on a bus, you're less likely to get to work, have income, you're less likely to maintain your health, you're less likely to have the well-being to keep also your health up. So being able to identify that was a key mobility challenge that impacted people's not only their financial and health and their mobility, but their physical and mental health was key, that RVA Rapid Transit reached out to GRTC to identify areas where there were few shelters and where there were low-income communities that had a lack of investment. So identifying those stops and using the partnership to bring us together, I would say that RVA Rapid Transit needs to take a lot of credit for that. Ben Campbell, who is now chairman of the GRTC board, was part of RVA Rapid Transit. I believe he had a role in that as well. And that's how it came to be. And then once that happened, it was a matter of just identifying these specific stops where we get the best bang for our buck. And there's criteria for how we decide which stops are the ones that we want to invest in first, and then getting them in the ground.
And I'll just say that, probably one of the best aspects of this whole project was working with GRTC, their openness for us to bring ideas and perspectives as a health system, but also as someone who listens to our patients and hears their perspectives as well every day about these bus shelters. So it was not let's just say that GRTC did not come in as this monolithic, we're going to put these bus shelters where we think that, we want them to go. But there was a lot of open dialogue. There was, with Carrie and the entire GRTC team during the public engagement process, there were numerous meetings held. But more than anything else, there was, ridership, how many people are coming on and off a bus stop is one consideration, but there are a lot of other considerations too that are factored in. A bus shelter heightens the perception of safety. People feel safer there. We also were considering, there are other improvements in the neighborhood, say along 9 Mile Road, improvements to the sidewalks that are currently taking place, but that we knew were coming down the pike. There were also specific riders would come in with, especially regarding people who had mobility difficulties, talking about certain stops that maybe they didn't have as high a ridership, but there was a real need to improve the access for those people who had mobility difficulties. So ridership was probably the primary criteria in making these decisions, but it wasn't the sole one. And a lot of other voices and considerations went into the process of actually deciding which shelters would go where.
So now that we know how this locations got picked, what are the next logistical steps involved in getting the shelters or bus stops installed once there's funding available, of course?
Well, so identifying the locations is probably the easiest part. We have a lot of data. We know where our routes are. We know where the boardings are and the highest ridership boardings are. We know where the key destinations are, where people are going to, that they might be re-entering onto the bus. So the return boarding locations, where our key hospitals are, or other community assets that people might be going to where the ridership might be a little bit less, but we might have more vulnerable populations. We know where the low income communities are, and we know where the jobs are. So we have a lot of data to help identify and prioritize where to put them. The challenge becomes the underlying infrastructure in those areas. It's the low-hanging fruits, the easiest ones to put in are typically those that are already in developed areas that already have investment and have businesses because they have the sidewalks, they have sufficient right-of-way, and they have, the overhead wires for power might already be underground. The drainage ditches might already be covered over. You might have the sufficient space for a sidewalk to be wide enough for someone in a wheelchair to get around a shelter. Those are places where the investments and the businesses are growing, and those are easy. And that's also tends to be where there's higher ridership because that's where the jobs tend to be. So they get a lot of focus. The challenge then becomes a spiral of always putting the investment in the places where the investments are going And so we have to step back and say, well, how about the other side of it? Those areas where the sidewalks aren't, the investment aren't, but people are living, especially underserved. And we have to look at those areas and say, well, they don't have sidewalks, and they don't have curb cuts, they don't have curbs, and they might have ditches right next to the road, especially if they don't have the curbs, and they don't have a sidewalk that connects them to a crosswalk. And so they're pretty dangerous locations, and they might have high ridership, but we can't put a shelter there because there's not enough space. So the next steps, what you asked is what the next steps is, to try and really prioritize some of those higher cost stations. Stations like the one you're showing might only cost us 10 or 20,000 to put in because of the cost of the shelter itself. When we go to the underinvested areas, you can look at implementing a shelter costing 50,000, 100,000. I've seen shelter programs up to $1 million if you have to extend a sidewalk a significant distance for ADA accessibility. So identifying the location and then identifying what the existing infrastructure will allow, and then getting more funding to be able to correct those infrastructure deficiencies so that we can put that in. And that can sometimes takes, years to get that investment in. That's a long answer, but next steps can be quite complex depending on if an area is already underserved and how we prioritize it. And it's very, very easy to prioritize the low-hanging fruit where investment already is, but we need to kind of turn that on its head and start prioritizing underinvested areas that might cost us more, but those communities need that lift. Those are the ones that are having the biggest health impacts from not having the infrastructure.
Yeah. Could you easily describe any lessons learned in this process or key points to remember that you think would be helpful for future partnerships to improve bus stop amenities? Or anyone who, whether it's Bon Secours or anyone looking to join GRTC in a local jurisdiction in this effort?
Yeah, I'd like to piggyback on what Julie said. If you are for private sector partners, it's very easy to say, hey, I want to invest in a bus shelter in front of my business. But try and think about the other side of the coin as well, and how you can leverage your money to be a catalyst for this as an entire system, not just these pockets of where we already have development, but think about this as this needs to be an amenity in any community. And unfortunately, the communities that need this the most often are the ones overlooked because there hadn't been a lot of investment in them to begin with. So try and think about this not only from a utilitarian standpoint of a benefit for you, but also as how can you take this and look at the wider community when you're making these investments, because especially the bus shelters are such a key part of making the transit system seem safe. So if someone's coming to you, to your business, they're also going home someplace, and they may not feel safe at their bus shelter at home, or they may not have the amenities there that makes that trip on using the public transit system one that's respectful and one that, quite frankly, they deserve.
Yeah, it's been a while since I've been in the planning side of the planning world, but when I was doing a lot of NEPA work and doing the roadway planning and doing the development planning, there was a strong emphasis that when a new development went in, that developer, whether it was for a business or for residential or for industrial, had a certain responsibility to improve the infrastructure around their facility. And I remember much earlier in my career, they tried to get impact fees that would go into maybe a city or a town fund, and then the city or the town might use those impact fees to improve infrastructure somewhere else. Those laws, there are a lot of court cases around that to try and prevent that. They're saying like, well, you're taking our money. It's almost like a bribe, or we're having to pay in so that you can do something somewhere else that's not directly related, having a direct nexus to what we're doing. Somehow being able to talk to the business community to help them understand it and work with the planners and work with the laws to say that there actually is a nexus that we need to consider, not just immediately around where something's developed, but also where people are coming from and going to access it. And if you're depending upon transit to get people there, then you need to look at the investment into the entire transit system, not just the transit system to your front door.
We have a comment in the chat, which is, would love to see better bus stops and sidewalks included as a general rule of thumb when any road project is happening in the region on bus routes. Is this linkage happening through Plan RVA? With mention that today is the deadline for comment on their proposed set of new regional transportation projects.
I'm seeing a lot of collaboration with my staff and with the city of Richmond and the counties of Chesterfield and Rica, that when we put our stops out and we put expansion out, that they are doing a lot of work to try and improve the infrastructure around our bus stops. Some of them are just in areas that are so underdeveloped that it's going to take us a long time and a lot of money to get there. So when we're looking at expansion and when they're talking about that, I think there is a shift in that mindset where a couple of decades ago, bus stops and sidewalks were value engineered out as not essential to transportation. I think that there's been a dramatic shift, that they're less likely to get value engineered out and they're more likely to stay in as part of the project and be elevated. I have been very encouraged since I've come to RVA about how open Plan RVA and our city and county partners are in making sure that those investments come along with the bus shelter. But with that said, with that optimism, we have a long way to go.
We've definitely touched on this throughout this entire conversation, but what are some of the key next steps for shelters in the East End? For instance, whether it is maintenance and care for the stops or potentially support for amenities at additional bus stops, while knowing that the infrastructure varies depending on where the bus stop is located.
Yeah, I guess that's for me again. unless of course you would love to adopt some stops there, Sean, with your folks about helping to keep them clean. That actually is a challenge. That the way the codes have been written in the past for us is that when we installed a shelter in a city or a county right away, that infrastructure, because it was in the city or county or state property, became their assets. And there was this kind of a, well, now they have to maintain it because they're asset. So a lot of our shelters, when we put them out, didn't stay maintained. They kind of started to get dirty and fall apart. The commitment that we have now from this board, from our partners, from myself, is that we're going to expand. We're going to put money into expanding the shelters. We use our capital money for that, but we're also going to expand the cleaning of them, and we're going to take that on as our own operational costs. Bold words to say, right, when I also put initiative to go zero fare, how am I going to get the money for it? But that's part of, why I get paid to sit in this chair, is to find that money. We'll be looking for business partnerships. We're looking for adopt-a-stops. I know there's some conversation with the RVA Rapid Transit around possible adopt-a-stop programs so the community can take pride and ownership and help with the process of keeping these maintained and clean. So it's a pretty broad spectrum of, once we have them in place, now we have to keep them maintained. And while that falls primarily and should fall primarily on the shoulders of the public entity that owns it, it's our riders that access it, our community that surrounds it. And we need to find a way to get pride and come together to take care of it.
Yeah, I'll just say that that is a struggle. And it's even, so this bus shelter that was installed in front of Richmond Community Hospital, we agreed with GRTC to maintain that bus shelter. And there are times when we haven't had a good handle on that. And you'd be amazed at how bad a beautiful bus shelter can look if there's trash everywhere and someone's not taking care of it daily. So a lot of that comes into grassroots efforts to encourage community ownership of these bus shelters, along with regular maintenance and cleanup. But it's going to take, it's something that everyone involved needs to be focused upon, because if you do not, what is a tremendous amenity will ultimately become an eyesore. And you'll start to see, a concern would be if a community is worried about getting a bus shelter because they don't want it to collect trash there. So there's more work to be done. But yeah, we're Bon Secours will be adopting some bus stops. I'm excited to pick up some trash and bring in some amenities to some of these new bus shelters in the East End.
Yeah, and I think that it's interesting when we start talking about when we put out the bus shelters and we put out the benches, we also try and put out the trash cans, and how they get, who owns the trash can, whose trash it is. Frequently we get it, well, GRTC is, it's their riders who are creating all this trash. And in some cases it is our riders, but it's also our neighbors and our constituents. And sometimes it's not the riders, it's the community around it. We have found that there are some trash cans where people will bring their trash and dump it, and they're not even riding the system, but it's a place for them to put their trash. And so we can come out and clean it, and the next day it is overflowing again. It's something we need to work to resolve. We don't have a handle on it yet, but we are. And can I answer the comment? There's a comment I see that I'd love to address.
Definitely.
Dan put a comment in there. Why do we keep calling all these things amenities? And you have nailed it on the head. When I was in Nashville, I had a little bit of an internal campaign to stop calling these things amenities, because amenities makes it sound like they're extra nice things to have to make, and they're not. They are essential. You are absolutely right. And as long as we keep calling them amenities, so I apologize for that. Thank you for saying that. And
Me too.
Keep me honest. They're not amenities. They are essential infrastructure to accessing transportation. Thank you for that.
I do want to say that I love call outs on dominant norm language. It's really important for all of us to consider that when we talk about a variety of things. So I was going to bring that up if no one else saw it as well.
I'm glad. Thank you. It is. We fall back into the words that we're used to using. And unfortunately, in this case, Dan is absolutely 100% right. The longer we call them amenities, the more likely we are to just say, well, they're not necessary. They're just nice to have. These aren't nice to have. They are essential.
Mm-hmm. For our last scripted question, I'll say, because I want to open this up, the chat up to people just throwing more comments and questions in there. We have about 7 more minutes or so of time for conversation, but is there anything we haven't had a chance to touch on yet that you would like to mention, either one of you would like to mention? And I think we may have lost Julie.
Yeah. No,
So
I really don't have anything to add, Kendra. I love bus shelters, and this has been a great conversation. Thank you for having me.
Yeah, thank you for participating and being here. Just wanted to give Julie a second to see if she was going to come back, but we will move on. So thank you. Oh, okay. There are, if anyone, we still have time for questions. If anyone has questions, we have GRTC staff in the audience. Julie is also still here in the chat as well. Yeah, so if you have time today, please fill out the Plan RVA list of projects for public comment, and it's open until 5 p.m. today. The link is in the chat. It is important to engage in these things if you want to see what you want to see. So love having these opportunities available. But also will not force questions from the chat. Carrie, is there anything you would like to add?
Hello, can you hear me okay?
Yes.
Awesome. Yeah, I'm actually going to drop into the chat a link for our bus stop page. And we continue to update this with where new shelters are being placed. So we've got the list from Bon Secours already on there. We've got a couple more that were scheduled for installation this week in the city. So you can check back there for a running list as we continue to get new shelters in and approved and placed.
I'm back.
Oh, nice.
Sorry about that, everyone. But Carrie, I'm so glad Carrie's on there. We have a couple of our staff members on who are amazing in advancing this program. So they got you covered.
Yeah, anyone who volunteers to jump in on short notice, I love that in a team. So there is a question in the chat. How can community members best advocate for bus shelters and essential elements? Is there a flyer or something that's printable that can be used for outreach?
I'm gonna probably let Carrie jump in a little bit here as well to answer this, but the best way to advocate for it is, one, let us know. Carrie gets comments, we get comments all the time, and Carrie sends those on to our planning staff to let us know where people are asking for them. But to also make sure that when you talk to, get involved with Plan RVA so that they can hear that we need more funding for these bus shelters and essential elements. Talk to your city, the county, and the city and the counties that these are things that you want to see around the bus system. I think that it's important for our elected officials to understand that transit is a priority to their constituents, and not just the service, but also the support of those essential infrastructure around our stops. So they need to hear this directly from constituents to be able to use that in their own budgeting process and planning process. Carrie, I don't know if you wanted to add to what we do around getting outreach to get more people involved in that process, or not.
Okay, I have unmute access. Great. Yes, we have thankfully started to see some of that hand-in-hand coordination improving with our partner localities. A couple of great examples. One that is connected to the Bon Secours bus stop shelter project in the East End is the 9 Mile Road pedestrian improvement project. A couple of those shelters that are already approved and funded through the Bon Secours project are not installed yet because we are coordinating with the city on their sidewalk improvement project. So that is a win, and it's great that we're having that go hand in hand together. Another one would be from 2018 when we started the expanded local route service in Henrico County on going out to Short Pump on West Broad Street. We were able to coordinate with Henrico County on determining where are the safest places for the buses to stop and where should we highlight pedestrian access. For example, the mall. As you get out to the mall, there is a lot of parking at the mall today. It was built for, Black Friday capacity all the time. And so that means that pedestrians getting on and off from the bus to go to their jobs or go to shop at the mall have a lot of parking lot to walk through with vehicular traffic going both ways. So they built this wide pedestrian marked pathway, and then the Henrico County video production team shot with us just a quick sped up video of what would it look like when you get off the bus. How do you access that pedestrian safe crossing all the way to the mall entrance? So it's even just making those visual connections so that people learn, especially with news service, how to use it, how to connect with your destination, because as has already been discussed, if you can't safely and comfortably reach your destination, then you don't have access by transit.
Is there a reason why there's a public comment period for items like trash cans, et cetera, to be added? Is that required by the localities, or is that a GRTC requirement, or both? The process seems very difficult and not accessible.
I keep muting myself and then I keep getting trapped in the mute box, but so this is an interesting question. As far as whether it's a requirement, we actually get a lot of NIMBY. And for those of you who don't know, I think most of us do, but in case you don't, NIMBY is not in my backyard. And we, both at the elected official, at the business, at the residential, and when we put the infrastructure out and we put a new stop out, or we take a stop away, or we put a shelter in, or take a trash can away, it impacts the people around it as much as it impacts the riders. And so everyone should be part of the process to have a voice in how the system is expanded or not. So as far as whether it's required to have it, I would say that it depends on the locality, what those requirements are for public meetings for that small infrastructure investment. But we're pretty committed to try and be transparent in the outreach and have the open forum. Now, that's going to go back to the question of what can I do to increase the number of shelters and assets and essential infrastructure out there. And what you can do is to help be a voice, an advocate. We already said to do it with elected officials, but also with the businesses, also with the community. When you're standing there, be a good advocate for transit and transit riders, be a champion of it, help people understand the value of it, whether it's your neighbor, your family, the businesses that you go into, why that shelter actually encouraged you to go to their business versus not, to try and dispel some of the myths around the negativity associated with transit essential infrastructure. It didn't quite answer the entire question, but it's a little bit of both. There's some requirement for some amount of public outreach, and then part of it is just transparency and being a partner with our communities. Gary, if you wanted to add to that, I don't know if you got stuck in the mute cycle also.
Okay. And Julie's exactly right. And typically we do provide a 14-day public comment period for stop infrastructure proposals, including for trash cans. And I'll take you a little bit more behind the curtain into the specifics of a trash can. So within the city of Richmond, we place trash cans along city trash truck routes, because that means that as the city trash truck is doing their normal pickup for residents and businesses, they can also stop and serve the city trash cans at our bus stops. So when you see a trash can at a bus stop in Richmond, it's on a trash truck route. That's not true in the counties. The counties handle their trash collection a little differently, as well as who's responsible for keeping the public right-of-way clean. In both Henrico and Chesterfield County, the adjacent property owner is responsible for keeping the public right-of-way clean and clear. So if you have as Julie was explaining, a nearby business who does not want to be responsible for keeping a bus stop trash can emptied on a regular basis, then they don't have to accept that trash can in front of their business, because then they would be responsible for it. So it really does get down into how does each locality handle trash and the logistics of who's responsible for it.
And we all know the squeaky wheel. So if we go to the public and everyone we hear from says, we don't want this here, and nobody speaks up for it, we don't have any background for why we need it there. Sometimes I'm taking more and more of a position of not always listening to the squeaky wheel, because a lot of times the squeaky wheel are the NIMBY folks, and not the advocates and not the people who really depend on it. The people who really depend on it tend to be voiceless. And so we're trying to balance that.
Great. Thank you all so much. Thank you to everyone who asked questions, and thank you to Julie, Sean, and Carrie for this discussion that we had today. We are going to transition now back to Faith, who is going to share about RVA Rapid Transit's new Better Bus Stop program, which falls right into a lot of this conversation that we had.
Yes, thank you, Kendra. That was a very powerful conversation, and thank you everyone for sharing and commenting. But this is a way for people to get involved. We have a lot of people on this Zoom right now are asking questions on how can I help, what can I do? And so what we've done is getting up a campaign called the Better Bus Stop program, okay? And so as you've just heard, that there's only about 5% of GRTC bus stops currently that have shelters, and another 20% have benches. So expanding those amenities for our system is very important. And now part of this program will give individual groups, civic associations, an opportunity to raise funds for essentials like bus shelters and benches. And so our goal at RVA Rapid Transit is to try to create a pipeline for this help. And then also it allows folks to adopt a stop by picking up trash and litter around them. Now, litter is so important, and this is particularly important for 3 reasons. For bus riders, regarding the beauty and cleanliness of a stop where they are waiting for a bus. And second, it's an environmental issue that affects streams, the James River, the Chesapeake Bay, and wildlife in our waterways. And third, litter, real or perceived, can be a barrier to the expansion of public transportation. Even though litter is an issue everywhere, it's not only primarily at bus stops, but when folks see trash at bus stops or believe that the bus stops are causing litter, they can become hesitant about having a bus stop nearby, or even extending or expanding lines in general. So litter can become a barrier for growth of our transit system. And so we're still finalizing some of the details and reaching out to partners in this, but we hope to launch this program by July 10th. So here's an overview. Adopters will commit to pick up litter at their designated bus stops for 1 year. Adopters can choose to do more if they like. RVA Rapid Transit will present every adopter with a startup kit to assist them in keeping their adopted stop clean and litter free. Those kits will include safety vests, trash pickers, and a one-time supply of trash bags and rubber gloves. Now, on this front, we are very grateful and excited to announce that we just won the Green Grant from Keep Virginia Beautiful, and this will help us supply those starter kits. So many thanks to Keep Virginia Beautiful on that support. So if you're interested in learning more about the Adopting a Stop and the Better Bus Stop program, whether it's yourself or you're part of an organization, please reach out to Nelson and myself, and we'll put our contact information in the link there. And so our goal and our heart, we absolutely believe that bus stops should be a dignified place for people to wait, and we definitely need your help to make that possible. So on behalf of RVA Rapid Transit, I just wanted to thank everyone again for being here today. Please note that our next transit talk is coming up 12 p.m. on Thursday, July 15th. We're focused on the city's Office of Equitable Transit and Mobility and its current outreach effort to Path to Equity. And so also, I just want you to put on your calendars that on July 10th, Bon Secours, the Sarah Garland Jones Center, right there where Sean is supporting, RVA Rapid Transit and the Sarah Garland Jones Center has partnered to host the Churchill Gospel Fest Saturday, July 10th. And so we welcome everyone to come out for an outdoor concert. So bring your families, your smiles, tambourines, whatever it be. So RVA, we will be launching our Adopt a Stop campaign that would encourage engagement through volunteerism. So if you or your organization would like to definitely adopt a stop, you can do so at this location. And if you can visit the RVA Rapid Transit's website, it'll give you more information about that. There's vendor spaces available. So if your organization wants to participate, you can reach out to myself. Also, if you have not joined our email list, we encourage you to do so that you can get updates about our upcoming transit talks and events that we'll be participating. And we'll email you a recording of today's event once it's up on our YouTube channel, so you can carry on this discussion. And thank you all so much for being here today. Thank you so much. And we'll see you on our next transit talk. Bye-bye.